There is a moment most people over 60 know well. About 45 minutes after lunch, sometimes less. Something shifts, not dramatically, not like an alarm going off, more like the air going out of a room. The eyes get heavy, the body feels like it is moving through something thicker than air. The thought that seemed clear a moment ago has gone soft at the edges. You sit down for just a minute, and the next thing you know, an hour has passed. Most people chalk it up to age. The doctor nods and says it is normal. And so it gets filed away under the long list of things you have simply learned to accept. But here is what almost nobody tells you at that appointment. That crash, that specific, predictable post-meal fog, is not an inevitable feature of getting older. In most cases, it is a blood sugar event, and blood sugar events have mechanisms. Mechanisms can be addressed, and one of the most quietly effective tools for addressing them has been sitting in grocery stores and health food shops for decades, studied in peer-reviewed research, used in traditional medicine on multiple continents, and almost never mentioned by the physicians who could most benefit their patients by recommending it. It is a seed. Specifically, it is fenugreek. And before you dismiss that as the kind of thing that belongs on a wellness blog between crystals and cold plunges, stay with this. Because the reason it works is not mystical, it is mechanical. And once you understand the mechanism, you will understand why the absence of this conversation in most medical offices is a problem worth paying attention to. Oh, here is what is actually happening during a blood sugar spike, and why it matters more as you get older than it did at 40. When you eat, especially carbohydrates, starches, sweetened foods, your digestive system breaks those foods down into glucose. That glucose enters your bloodstream. Your pancreas responds by releasing insulin, which is supposed to escort that glucose into your cells where it becomes usable energy. In a younger, metabolically healthy person, this process moves smoothly. Glucose rises. Insulin responds. Glucose comes back down. The curve is gradual. But as the body ages, insulin sensitivity tends to decline. The response becomes slower, less precise. Glucose rises faster than the system can catch it. The spike is steeper. The crash that follows is harder. And the inflammation triggered by repeated, sharp blood sugar swings accumulates over time, quietly contributing to fatigue, cognitive cloudiness, joint discomfort, and a range of metabolic conditions that physicians spend years treating the consequences of rather than addressing the root. You have been told the problem is sugar. Cut the sugar. Watch the carbs. Eat more greens. And while none of that is wrong, it is incomplete. It is like being handed a mop while someone leaves the tap running. The water is still coming in. The real question is whether anything can slow it down before it floods. This is where fenugreek enters, not as a cure, not as a replacement for medical care, and not as something to take without discussing with your doctor, but as something that deserves to be part of the conversation. Fenugreek seeds contain an unusually high concentration of soluble fiber, specifically a type called galactomannan. When this fiber comes into contact with water in your stomach, it forms a thick, gel-like substance. That gel physically slows the digestion and absorption of carbohydrates. Not by eliminating them, not by blocking them entirely, by slowing the rate at which glucose enters your bloodstream. Slower glucose absorption means a more gradual rise in blood sugar. A more gradual rise means a gentler insulin response. A gentler insulin response means less of a spike and less of a crash. If you have spent years following the rules, reading labels, cutting the desserts you actually enjoy, doing everything you were told, and you are still getting that afternoon crash and being told it is just aging, hit the like button. Because what you were given was not wrong. It was just missing a lever, and you deserve to know about the lever. The clinical evidence for fenugreek's effect on post-meal blood glucose levels has been replicated across multiple peer-reviewed studies. Research examining populations specifically managing type 2 diabetes has consistently shown measurable reductions in post-meal glucose spikes when fenugreek is consumed before or during a meal. One line of research found that fenugreek's galactomannan fiber slowed gastric emptying, meaning food moved more slowly from the stomach into the small intestine, which directly reduces the steepness of the glucose curve. Now here is where intellectual honesty is required, because this channel does not trade in certainty it has not earned. Fenugreek is not insulin. It is not a pharmaceutical intervention. For someone already managing a diagnosed metabolic condition, it is a complement to treatment, not a replacement. The research is encouraging. It is not a closed case. And if you are on blood-thinning medications or diabetes medications, you speak with your doctor before adding this to your routine because its glucose-lowering effect is real, and real effects can interact with other real treatments. But for older adults who are not yet managing a diagnosed condition and who are experiencing the creeping fatigue, the post-meal fog, the low energy that has been filed away as simply normal, this is exactly the kind of tool that deserves serious attention. Not because it is miraculous, because it is real, it is accessible, and it costs almost nothing. But here is something most people get wrong when they first hear about fenugreek. They buy the seeds, try them once, notice nothing dramatic, and move on. The problem is usually not the seed. It is the method. There are 3 specific rules that determine whether fenugreek actually works, and the wellness blogs that mention it almost never get all 3 right. Rule 1. The form matters more than you think. Whole fenugreek seeds pass through your digestive system with the galactomannan fiber largely intact and largely inaccessible. To get the gel-forming effect, you need the seeds ground, either purchased as a powder or ground at home. If you grind them yourself, buy them whole and use a small coffee grinder. Ground fenugreek oxidizes faster than whole seeds, so grinding fresh preserves both the fiber and the active compounds. Rule 2. Timing is the mechanism. The entire point of fenugreek's gel is to be present in your digestive tract when the carbohydrates arrive, so the glucose has to move through it rather than rush past it. That means consuming fenugreek approximately 20 to 30 minutes before a meal, or mixed directly into the meal itself. Taking it hours earlier, or as an afterthought once you have already eaten, is like installing the gate after the traffic has passed. Rule 3. Hydration activates the fiber. The gel only forms in the presence of adequate water. Consuming ground fenugreek without increasing your fluid intake does not create a barrier. It creates a dense mass that can cause exactly the digestive discomfort that makes people stop using it. At least 8 ounces of water alongside fenugreek allows the fibers to expand properly and perform their function. Save this video. The next time you are planning a meal you know is higher in starch, the rice, the bread, the potato, you will want to come back to these 3 rules and make sure the conditions are right before you dismiss the result. The amounts used in clinical research typically range from 5 to 15 grams per serving, roughly 1 to 3 teaspoons of ground powder. Fenugreek has a slightly bitter maple-adjacent taste that most people find manageable when mixed into water, stirred into oatmeal, or blended into a smoothie. The side effects are generally mild, some digestive adjustment in the first week or 2, and a distinctive body odor in some people that is harmless but worth knowing about in advance. Here is the watch-through reward, the piece of this that most coverage of fenugreek never reaches. Beyond the gel-forming fiber, fenugreek seeds contain compounds called saponins and a unique amino acid called 4-hydroxyisoleucine. This amino acid has been shown in research to directly stimulate insulin secretion from the pancreas in a glucose-dependent manner, meaning it may help the body produce a more timely insulin response, not just slow the glucose down, but improve the system's ability to respond to it. This is the difference between installing a speed bump and repairing the brakes. The fiber buys time. The 4-hydroxyisoleucine may be working on the underlying response mechanism simultaneously, which means fenugreek is not doing one thing, and it may be doing two at the same time, which is why the research on it keeps producing results that feel disproportionate to how simple the intervention is. Think about the person in your life who is managing their blood sugar, watching what they eat, doing the right things, and still getting that crash every afternoon and accepting it as the price of getting older. Send this to them, because knowing the mechanism changes what is possible. But fenugreek addresses what enters the blood. It does not address what happens next, specifically how your muscles pull glucose out of circulation after it has passed the fenugreek barrier. That process has its own mechanism. It operates in a specific window after eating, and it is almost never discussed in the same conversation as dietary interventions, even though the two work in sequence. Or understanding that second mechanism is what completes the picture. You are not someone who accepts this is just aging as a final answer. You are someone willing to understand how your body actually works, not just what symptoms to manage. That is a different relationship with your own health than most people your age are having, and it leads somewhere different. The post-meal fog is not your imagination. The afternoon fatigue is not simply what getting older feels like. The mechanism is real. The evidence for addressing it is real. And you deserved to know about it years ago. Before you go, I want to hear from you. What is the one piece of health advice you followed faithfully for years, dietary, medical, lifestyle, that you later found out was incomplete, outdated, or shaped by something other than your best interest? Write it in the comments, because the answers to that question matter. And other people watching this need to see that they are not the only ones who were given the wrong map.